Oh hey guys, welcome to my home again. I'm Ceci, and today I'm going to show you what's in my leech therapy bag. And it's not little, so prepare yourself to watch. So if you're one of the people that calls me up on the phone and says, Ceci, I have acute pain, or I'm not feeling well, I have pressure, can you do something about it? Can you come over and apply leeches on me? I'll be like, yeah, sure, I'll see what I can do. So then I go and I fetch my trusty leech therapy bag, which I take with me with all of my necessities. And it's about, sort of like a medium size. And I take that with me. Somehow I have to fit in that bag all the goodies that I will be using for the leech therapy, which is not, they're not a few. It's so much. Usually I put only a few of them in order for me to be able to fit everything into here. On top of that, I have to carry the leech jar as well. One more thing. I also have to carry another jar for the fed leeches because they can't get mixed with the hungry ones, as you know. And this is my jar of leeches that I carry with me. You see that these are the cosmetic ones right now. They are tiny little babies. They're so small, I'll show them to you in a little bit. And the other jar is just an empty jar with water. Okay, so let's look at what's in my bag, shall we? So the main thing that I carry with me is this little pouch. This pouch contains everything I need for my therapy. But before I show you what's inside, I'll show you what else I carry with me, and that's a bag with my shirt that I use for my uniform. I used to wear stuffy uniforms when I first started out doing therapy for people. I no longer do so because my uniform is it doesn't allow my body to breathe. So I've replaced it. And so right now what I take with me is just a plain cotton shirt. It's just clean and white. Sometimes I wear it and sometimes I don't. So it's just a plain shirt, cotton. Just in case I get dirty from the blood, I can then just sanitize it at home, wash it, and it's good to go again. Also, instead of uniform or cotton shirt, what you could bring with you is disposable aprons, for sort of like the ones they use in hospitals, emergency rooms. They do sell them online, and they come in like packages of probably like 10 or 20. So I would recommend buying those if you're not into bringing a uniform with you. Sometimes I'll wear this uniform even before I go to the patient's house. And sometimes I put it on when I get there. The next item in my bag is this pouch. Now there's lots of things inside this pouch. It's very, very full. First thing is my mask. And those are disposable. So you'll need a new one every time with every patient. And this one is just bendable. There's a little sort of iron, what do you call it? Like a metal rod at the top. So when you put it on, it will conform to your nose. And you'll need to buy probably a box full of these because one wouldn't be enough. The next thing inside the pouch is lots and lots of cotton. Cotton is used to sort of pad the wound, for padding, and when it's being bandaged. So whenever I'm bandaging the wound, I would put cotton underneath just to absorb excess blood. There's also small cutouts from feminine pads. These are used to bandage small wounds, sort of like the kind that would be formed from a cosmetic leech. So those tiny little ones wouldn't be sufficient for a big wound from a big or medium-sized leech, just from a small one. Then what I also have is these deodorant caps. I use those to cup the leeches and put them in one place in order for them to bite in that particular spot. Let's see what else is here. I also have an extra supply of feminine pads. These ones I use for bandaging as well. This is the extra thin kind, extra slim, and it's like a cotton feel. It's not the plasticky feel. What do they call it? A silk feel or something? I wouldn't use the plasticky silk one. I would use the cotton one. It's better absorbent, in my opinion. And you should always bring with you or prepare with you more feminine pads because you just can never have enough. They are absolutely necessary for therapy. And I have the more absorbent kind and the less absorbent kind. But what you want to do is prepare even more than this, even more absorbent ones. There's the ones for overnight usage. There's also another thing you could use. You can also use swim pants for little babies, for toddlers or whatever child, and then you take the swim pants and you would have to cut it up, but this part of it is extremely absorbent. So if you have somebody with one area of like 10 or 20 leeches just in one spot, then you can just cut this part out and bandage it there. Trust me, you'll be needing several of those. One is not enough. When I was first starting out, I couldn't believe it. I couldn't believe it. You would have to use feminine pads. I mean, it just seemed too much for me. But once I tried it the first time, I was like blown away. How much oozing, how much blood comes out. The next item in my bag is my gloves. I have a bag of gloves I bring with me, and usually I change. Sometimes I change several pairs, and sometimes I use just one pair. These are the what do you call these? The not the silicone free, not the latex free. These are the latex ones because I actually prefer them. They're more flexible, they're more bouncy. I also have a bag of small, short tweezers, plastic ones for the leeches. These are very handy when you're working with cosmetic leeches, and I'll show you why. it would be difficult for me to handle a leech of this small size with the traditional forceps. And I'll show you how small it is. It's just so tiny. See, compared to my finger size? Just a tiny little baby. So obviously this is a good sized tweezer to use for that baby. See how small they are? So this tweezer is the best. Okay. Now, next item on the list. I always bring the syringe with me. I don't know why, because it never works. But I still have faith in it. It might one day start working for me and then I won't have it, or I'll need it and I don't have it. So I bring it with me just in case. And then I also bring with me some cups for wet cupping. Sometimes the clients will say, well, you know, we are Muslim, we're used to hijama cupping or fire cupping if they're Chinese. And what kind of leech therapist are you when you don't know how to cup? Well, I do know how to cup, and I do cup all the time. And I cup with bloodletting. So the lancet needles, the pricking needles, is what I use for the bloodletting. So what you would do is you take one needle, open it up, prick the patient, then apply the cup and draw out the blood from the cup. That's how it works. Next item on my list, on my bag, is the forceps, the traditional large forceps. I'll show you why I'm not able to handle small leeches with these. See, it's just like I'm gonna drop it any minute now. See, it dropped. So this is nonsense. It's just useless. You can watch a separate video on how to use cosmetic leeches in your leech therapy. I'll do a video for that. So far we've got these fire cups. What you do with the fire cups is you light a fire inside and you apply them on the skin of the patient. I'm not going to show you how to do that now. I'll do a separate video for that, but it's an effective technique to get rid of colds and fevers, as well as any kind of stiffness in the back or in the muscles. You can apply them anywhere. The bloodletting cups, they're also called hijama cups. Those are used for bloodletting techniques usually, and if the patient wants more additional bloodletting other than the leeches, I combine the two things. So I might put leeches and then on top of that I might put a cup, or I might put a cup and then leeches on after the cupping. The next item that's in my bag is a little bit of rubber bands, just a few, and a clean cotton cloth. This is for bandaging, and when you bandage somebody with it, what you could do is put a couple of rubber bands like this just to hold the bandaging in place. So it's very useful and effective to have these handy. And of course, leech forceps. There's links below, by the way, where you can purchase all of this as well as the leeches themselves. Leeches.com sells everything that you see here. This is my Scalpels, scalpel knives. You would open this up. This is disposable, sterile. You would open it and then you would cut the patient's skin before you apply the bloodletting cups. If they don't like the needle, then I use these razors. Next item is another bandaging material. So I bring all of this with me just in case, because I might not need all of them for one therapy, but if I do need it and I don't have it, it's going to be, this is a triangular piece of bandaging material. It's used for wrapping the wounds. You can also use it to tie the wound. What you also want to prepare when you are going to therapy or when you are having therapy done on you is a big towel. Always have a big towel handy, like an old towel, because if the bandaging materials fail or if there are too little of them and they don't do the job, then you always have the towel to wrap yourself with and use that for hours and hours and hours to absorb the blood. Sometimes I don't even use any bandaging materials at all whatsoever. I just use a towel, and that's enough. That's really, it's just, this is more feminine pads, but anyway, a towel is just enough to take care of your bandaging. Also, while the therapy is going on, you want to have a roll of tissue paper or Kleenex, a box of Kleenex. Usually the patient provides that. And the reason you would have it is because constantly there needs to be absorbing of the blood that's coming out. So you're probably going to be using a really big part of this. So as you can see, all of this has to fit into my bag, not to mention the tape, the masking tape. I bring 2 different sizes. And what this is used for is to secure bandaging in place. So say I have a very difficult place to bandage, all I do is just put a piece of tape like this. You see? And I'm in business. So this is essential to have masking tape. And of course a smaller size one is used when you have a smaller area or not so large area to work with. I hope this was educational for you. I do hope you would subscribe to follow me on YouTube here, as well as I have links below to follow me everywhere else. And please thumbs up my video and subscribe. I'll see you next week. I put out new videos every week. My name is Ceci, and thanks again for visiting. Bye!